Hey, Jules the Doula here, welcoming you to the Virtual Mama Connection. Listen in with me every week as we bring you birth stories and experiences straight from our parents' hearts, always providing you a lifeline of education and communication, keeping you ahead of the game with the best of the best care providers and educators. And just a little reminder out there, anything you hear on our podcast is not to be used as medical advice. Please visit our disclaimer on thevirtualmamaconnection.com. Hey, Jules the Doula, back this morning with Kim Bryant. We are so excited to have you. This is a special segment really discussing pelvic floor. Kim Bryant is a very well-known PT for the pelvic floor here in the Phoenix area. And I refer a lot of clients to you, Kim, because you're not just excellent at what you do, you're fun. You make all my mamas feel very comfortable. And I'm really big on educating women out there on why they should see a PT before delivery. But this special segment, we're going to talk about cesarean recovery, which, this happens sometimes. We have to bring our babies in that way. So welcome. Thank you so much for being with us. And tell us a little bit about why you chose as a PT to narrow in on the pelvic floor.
Well, as always, thanks for inviting me on to chat with your community. I love doing outreach. I think it's so important for mamas to know more about their bodies, healing, and particularly about pelvic floor. So thanks again. So I was a physical therapist for many years, and I actually started down this path of pelvic floor when I was in the geriatric population. And I started asking my patients how they were sleeping at night. And 9 times out of 10, they would say, hey, I get up 2 or 3 times to go to the restroom, and I have a hard time falling back asleep. And I thought to myself, well, no wonder your body's falling apart. You're feeling fatigued, you're falling because you're not getting that adequate rest at night to just maintain our body's healthy cell recovery and homeostasis. So I had reached out to a friend of mine at the time that was doing pelvic floor and said, I need something. I need to be able to address this piece of the puzzle. I felt like I was really doing my patients a disservice by not addressing that. And so she gave me some things that I could do, but said, if you really want to go down this path, why don't you take this first course? And that was over 5 years ago. And I haven't really looked back ever since. I've learned so much. And I think after my postpartum recoveries and how challenging those were, and not having resources and not knowing what to do, or how do you get back to exercise and how do you care for yourself, that really just fueled me to go down this path of pelvic floor. There's so many people just underserved, I feel like, in this community. So I opened up Thrive Pelvic Health and Wellness a few years ago, and then we just opened up Thrive Pediatrics this January. So we're just really happy to be able to provide this service for our community.
I'm glad you're here in this community as well. I mean, we live here, so I feel very fortunate. You help people virtually as well, right?
Yes, we do have virtual sessions as well.
That's excellent.
So,
excellent.
Yeah.
Well, so narrowing down on the cesarean recovery, let's talk about that. What would you say? You've got a mom, she's in the hospital, she's getting ready to leave. Why don't you take it from there? What should we be looking at?
Yeah, I would say to start off that 1 in 3 in 2011, 1 in 3 births were via cesarean. Wow. So, which is a really high number. And so I'm sure you can, and that might look a little bit different based on the setting, and especially those that are using your services, but it's been a gradual increase over the last 15 years. And so there's nothing regardless of how your baby enters this world, I think it's important to have that support. But since there's more and more of women giving birth this way, I think it's really important for us to recognize and give them that support. I can't tell you how many moms come into our office after a cesarean and they say, I didn't know I was supposed to do some scar mobilizations. I didn't know that I was going to have some pelvic floor issues because I didn't give birth that way, or I didn't know how to manage my pain. And so I'm really happy that we're talking about this. And even the American College of Obstetricians and Gynecology said that this procedure potentially could be overutilized because there really hasn't, it's supposed to be a life-saving surgery, and there hasn't really been any major increase in maternal or neonatal mortality rates, even though there's been this increase in cesareans.
Yeah, I gotta say, as a doula, I don't see a lot of cesareans, but I'm glad we're discussing it because you know what? Every now and then we do. And I do feel like the OBs that I work with really try hard to not go down that road. But if we have to, and we're saving a mom and saving a baby, then yeah. But one thing you just brought up that I definitely do think moms don't ever think about is, oh, I had a cesarean. Why do I need help on my pelvic floor? I didn't give birth that way. Right.
Yeah. And that's, I'm sure, a really common thought that goes across their minds, but our bodies, regardless again of how your baby enters this world, your body still goes under all of those pregnancy changes. So there's changes in our rib cage, our diaphragm and how we breathe, our abdominal wall, our pelvis changes position, and then our pelvic floor also gets stressed. So one of the studies that I was looking at in preparation for this had looked at women that all had cesareans based on, excuse me, I take that back. So they all had, that's why I have some notes. It's hard for me to remember all these things. So they had two groups. So they were both breech presentation. Okay. And so all the moms had babies that were breech. There was one group that had vaginal births, and there was another group that had cesarean births. And so when they looked at them from a long-term standpoint, both moms and babies recovered well. The main difference, because they followed them at 2 years postpartum, that the moms that gave the vaginal birth had a little bit of incontinence compared to those that had the cesareans, but overall they both ended up, babies healthy and moms were healthy. So, and that was, breech is one of the primary things that I see, yes, that can
lead to cesarean.
Yeah.
Yeah, I do too.
So, some of the other reasons why someone might have a cesarean is if they're a failure to progress, if there's concerns about the baby or the maternal well-being, sometimes with multiple pregnancies, or the twins, multiples. Do you see a lot of multiples yourself? And
actually, I don't do a lot of multiples.
Okay.
They just don't come to me, I guess. I haven't had a lot. The ones that I have not been cesarean, but I would say the two biggest things that I've seen with cesareans, definitely breech babies, right? Yes, mm-hmm. Multiples. And then if there were, I had one mama who had a very, very large baby, 11 plus. I'm like, this wasn't a baby. You had a linebacker, right? So a very, very big baby. And that's been one in all the births that I've done. So I don't see a lot. I'd say the biggest is, are the breech babies.
Yeah, I would say, yeah, breech. So if you're listening to this and your baby is breech, please reach out to your team. So that would include a pelvic floor physical therapist, a chiropractor that's Webster trained, and then also check out spinning babies.
Yeah, I love spinning
So
babies.
yeah, would you add anything else to that?
No, I would say that's exactly what I tell my moms to do. Usually I send
Yeah.
them to you. I have great chiropractors that all do Webster technique. And then, yeah, we all send them to spinning babies. I think that is the biggest one of all. I mean, the positions and then what you guys can do with the pelvic floor, in addition.
Yeah.
Yeah.
Yeah. I've had I haven't had a ton come in breach. But I mean, even some of the things that we can do to help on abdominal wall and pelvic floor to allow baby space to move, to allow the spinning baby techniques to be more effective, has been really helpful.
Good.
Has been really helpful. Yeah.
That's good.
So some other things that might lead to a cesarean could be if mom is having diabetes or high blood pressure, or if mom is having any sort of like infection or illness. So those are some of the lists. But again, I would say breach and failure to progress are probably the two big ones that I hear and see in the clinic.
Okay.
Yeah.
So then after a woman goes through, a cesarean, she's in the hospital I see them really, I mean, I know it's on a case by case basis, but a lot of the moms are coming home within a couple days, and naturally healing takes longer, right?
Mhm.
But what are some red flags that they need to kind of they need to call their care provider after they get home? What would the normal process be for healing? And then when should they kind of call you?
Yeah, I would say first off, what other major abdominal surgery do you get sent home within like 2 to 3 days plus having a newborn?
Yeah.
It's crazy. It's the expectations. And so it's, a really big surgery. I'm going to go over, after I go over some red flags, I'm going to go through a little kind of felt um, diagram of all the many layers, so we can really get an idea of the depth of surgery and what that means. But red flags that I would be concerned about is if the wound opens up, that I would call your provider immediately. If you have any signs of infection, so that would be a temperature over 100.4. It could be red. It could have a foul odor or a yellow or greenish like discharge. So all of those things might, I would say, contact your provider immediately. It's not something that you want to mess with. I've unfortunately have had a couple of patients in the clinic that have had infections and even a wound opening.
Oh,
And it just makes recovery
that much longer.
yeah, and your body holds on to that trauma, and so it definitely can have a lasting impact on the body. So those would be things to immediately contact your provider, or if you're unable to get a hold of them, I would even go to like an urgent care. You just don't want infections, can get nasty real fast, and it's not something you want to mess with.
Right. And antibiotics can take care of that pretty quickly,
Yeah.
right? Yeah.
Yeah. Um, so I'm going to go through really quick here all the layers of a cesarean. So when you have that, so it's a little anatomy of a cesarean. So
Okay.
we've got our skin here.
Okay.
And then they go through a layer of fat.
Okay.
Then we have our fascia. Okay. And right now these are showing a horizontal cut. I often see that horizontal cut right above the pubic, like bikini line area.
Yes.
I think I've maybe seen one or two that are the kind of up and down, but I definitely see this,
I agree. Yeah.
horizontal one a lot more often. Then they move, they don't necessarily cut, they just move the abdominal muscles out of the way. So they open that up. Then you have your peritoneum, which is a thin layer of tissue.
Going deeper and deeper.
Yeah, keep going deeper. Then they're going to move the bladder down a little bit. And then they make another horizontal, they make a horizontal cut into the uterus or incision. And then they'll have to cut the amniotic sac. And then that's when they'll bring the baby out. Yeah. So it's depending on if this was scheduled or if this was an emergency C-section, that can also have an impact on your tissues and your recovery. So
many layers. There's so many layers. So how long really is the healing process from your perspective, from a PT's perspective?
Yeah. So the tissues don't get, those tissues that are cut will never get to their full integrity or return to that full integrity. But about a year, there'll be about 75%, which is pretty close to where they're going to be at. So, but it can take, we give those first 6 weeks for just some tissue, but up to those 12 weeks after, we're still taking it pretty easy after cesarean. Oftentimes you'll be limited to only lifting the weight of your baby. But even that can sometimes be very difficult. So I think having that community, maybe looking into a postpartum doula can be really helpful, especially if you've got other little ones at home. It's got to be really challenging.
Yeah, that's rough.
Yeah.
And you can see why, when you go through all those layers, why we don't want to lift a baby, bend down to, load the dishwasher, like these little things, as far as like taking care of things in the home even, are kind of a big deal on your body and recovery.
Yes, absolutely. Absolutely. I would say big things when you get home is hydrate. You want to make sure that you're getting enough fluid. That's going to help with the healing process. Unfortunately, there's nothing we can do to speed up recovery. There's no, if I do this, it's going to be faster. Our bodies just take time to heal, but there are definitely things that we can do to slow that down or impede the healing process. So if you're overdoing it, that's definitely going to impact that. We know sleep, we lose a ton of sleep, those early months. So really resting is important. I love the idea of that, 5 days in the bed, 5 days, on the bed, 5 days, near the bed. It sounds fantastic. If you're able to do that, I think that really can help with your recovery, but not everybody can do that. I know I couldn't. Right. But it sounds fantastic. But, if you're able, I can't stress enough is the rest is really important. Nutrition. We want to make sure that we're avoiding any straining, or constipation is really big. So that's where the water comes into play, making sure you're eating enough fiber, and little movement. Like, I'm not saying go out for a mile walk, but just getting up and moving those first couple days, just walking to the bathroom, and getting up and moving around the bedroom can help with keeping things moving and also help with some of the inflammation as well.
Yeah, circulation's so important. I know even after the cesarean in the hospital, they get you up and moving on the floor right away. And
Yeah,
I know it's difficult. It doesn't feel great,
yeah,
These poor mamas are sore, but the circulation is really important.
yeah, yeah. Um, so one of the tools that I like to use to help manage pain, and I feel like it's such an underutilized modality, is ice or a cool pack. And it doesn't, I know a lot of moms are very sensitive, or have like a hypersensitivity around that incision, but even just putting a cool pack above or below where it's tolerable for 10 to 15 minutes, a few, 3 to 4 times a day, can be really helpful in managing pain, and decreasing that inflammation. So,
Well, yeah, that's ice is always good. It's not always fun, but it definitely helps with the inflammation. Well, so what are some other things they can do, or when do they start coming to see you to help with, pelvic floor recovery after a cesarean?
yeah, I recommend coming in after that 6 week mark, to just
Okay.
get an assessment of, let's look at breathing, let's look at posture, pelvic floor. I will do a visual, and just very gentle assessment of cesarean, make sure things are moving well. I don't get too aggressive with my manual techniques until tissues have really had a chance to heal. And again, that can look different for a lot of people
Sure.
depending on how their recovery has been. So, but even before people can come and see me, I always, breathing a gentle breaths into that space, will help mobilize those tissues, help with inflammation, and also just get things, that core, back on board. We want that system to be able to support you. So breathing into that space. When you are getting in and out of bed, or if you are lifting your baby, one of the techniques that I utilize a lot, is a technique by Julie Wiebe. It's called Blow As You Go. That's where you do a nice gentle nasal inhale, allow your abdomen to gently expand. Also, that expansion goes down into pelvic floor. So it's that nice kind of inhale, expand. As you exhale, I want you to gently draw in your abdominal wall and close and lift with pelvic floor. That's going to give you that nice kind of internal support, that hug. And then you're exhaling and maintaining that hug of support while you move. So that can be just rolling over in bed using that technique. But even getting in and out can be really helpful in making sure that you're not straining.
Right.
And then also to help wake up that system and say, okay, core, I know it's been a couple months since you've been helping me out. It's time to come on back.
Right. And then that's it, that's kind of like something they can start relatively soon, right? Like you said, helping them get in and out of bed, and they're starting that process of activity and breath and healing.
Absolutely. Yeah. You don't have to, that's one thing I really want to stress, is that you don't have to wait till that 6 week mark, or when you've been cleared, to start regaining some strength. And again, I'm not saying I want you to go out walking miles, or I want you to go, do HIIT training or lifting weights. We can make mindful movements. We can make getting in and out of bed or up and down from the toilet very therapeutic. Can we add a little breath control and core activation to make it more useful for our bodies and protect our body? So just simple things like that can be really, really helpful.
And then after 6 weeks, that's a really good time. Let's say the cesarean went well, they got home, there was no sign of infection, everything was great, they didn't need to call anybody. At about that 6 week mark, that might be a good time to come in and see you and just do an overview. And then if mom's feeling okay, is that when we would slowly start incorporating in walking and, their
Yeah.
exercise? Because moms are always saying, oh, I want to get back in shape. I want to start my workout. But that's a big deal after a cesarean. So do they still, I mean, I know it's individual,
Mhm.
but would a lot of moms that, are on the healthy road to recovery be able to start that process at about 6 weeks, you think?
Absolutely. Absolutely. I usually will start, once the incision is healed, which is, again, that's just the skin. The skin is healed. But there's still a lot of changes and recovery that's going on underneath. Um, but once that incision is healed, we're using our breath to help mobilize and the scar. We don't want things to get stuck. When scar gets stuck, that can impact potential future births, that can impact bladder health, that can impact core activation and just pain in general. So it's really important that we get that scar moving. So what I'll usually have them do is just start with some of those breaths in a variety of different positions. And then I'll also have them do some desensitization along that scar, especially if they still have some numbness, tingling, some areas where it just feels funny. So things like a dry washcloth, maybe a cotton ball, a silky material, and just desensitizing that area so that the nerves aren't on high alert. If
So
that
just
makes sense.
rubbing it along that incision line.
Mm-hmm. Yeah.
I've heard that even with women who've had tummy tucks,
Mm-hmm.
that they feel that incision line always feels funny. It never feels quite normal again. So those are things that they could do.
Absolutely.
Yeah, that's
Absolutely. Yeah. And I usually will say, because sometimes those sensory nerves just get damaged, again, depending on if it was a emergency versus planned, that's going to look a little bit different for your body and the providers. But if you're still feeling areas of numbness up to about that year mark, most likely that's kind of just how the tissues are going to be. I don't see a lot of changes in the sensation after that year.
okay. That's good. That's good for everyone to know.
Yeah.
Now, what about with a surgery like that? They started walking. Is there anything that would be harmful if they're runners? Let's say they want to start running, the jolting, that constant bam, bam, on the road.
Yeah. Yeah. That's why it's important to see a provider and a pelvic floor specialist afterwards. It's because those tissues need to have that shock,
Right.
that shock absorbing. We don't want them to be really rigid. If it's too rigid, then that's when we can have pain, we can have leakage. And so we want to have good mobility of not only the skin, but the fascia, the bladder, the uterus. Everything needs to be able to move and have that give, whether you're coughing or laughing or running or playing with your kids. Like we need to have that movement. Our tissues, our organs, our vascular system was not meant to be stagnant. They don't like being stagnant. So that's why it's important to get things get things moving, especially that scar.
So running can be okay. We just have to go take it slowly.
Yeah, I would say if you had been running prior to getting pregnant and even into pregnancy, and you had I would say a quote unquote relatively healthy typical pregnancy, close to around that 6-month mark, give or take, depending on recovery, is when you can start to expect to do some of that jogging and things like that. So,
And heavy lifting. What about women that have been lifting? That would be comparable to the running, right?
Yeah. And I always say, let your body let you know. It'll let you know, but it's important for us to listen. I feel like that's the biggest thing is especially women. I feel we tend to kind of just brush things under the rug. Oh yeah, I know that's kind of been bothering me for a while, but I'll just push through it. I'll just push through it. I feel like pain, leakage, vaginal pressure, abdominal doming, those are all red flags. Those are all like your body saying, hey, this is my check engine light. Something's not right here. And if we keep pushing past it, then we're going to create just further damage down the road.
I like that. I mean, I teach childbirth education, and I always say, listen to your body, right? As far as guiding you in when you are in active labor, that type of thing, listen to your body while you're in labor, but it's also listen to your body after, right? Always.
Absolutely. Absolutely. Yeah. If something's hurting and doesn't feel right, it's probably not, so try and do modify your routine. See if you can do that task, maybe with a little bit less intensity, and see if that helps. But if not, then, I recommend seeking help. It's not going to get any better if you just keep pushing through it. I mean, just because you can do something. Yes. Exactly.
Well, Kim, exactly. So this has been really enlightening. I mean, I think a lot of women would think, oh, I don't need to see a PT for the pelvic floor after a cesarean, but there are a lot of reasons that they should. You can help them. You are excellent at what you do. How can people find you? What's the best way, whether it be after a vaginal birth, before, after a cesarean? What's the best way for all of our listeners to get a hold of you?
I would say you can go directly onto our website, which is thrivepelvichealth.com. There's a lot of great information there. If you have specific questions, you can use the contact form there, but you can make appointments, whether that's in person or virtually from the website. But we have also a lot of great tips on our Instagram, so Thrive Pelvic Health. So you can follow us there, and your Instagram, your Instagram is definitely fun. I would encourage everyone to follow you. I always learn something and I laugh at the same time. I mean, you're quite comical and it's fun. So it's a blast. I'm always like, this woman should be a comedian. I have fun. You do. And you're excellent at it. And you're teaching us while, we're laughing, and what's better than that? So Kim, thank you so much for joining us. And I hope all of you listeners out there have really gained some valuable information. And we will definitely look forward to having you back on, Kim. So everyone, give Kim Bryant definitely a call out there at Thrive Pelvic. You'll be glad you did. Thanks, Jules. Thanks. This segment brought to you by Cave Creek Beer Borough. Add a little personality to your next party, wedding, or corporate event. Invite Cave Creek Beer Bros to entertain your guests, arriving in style and serving your beer, wine, or beverage of choice. We guarantee they will be the talk of your party. Check them out at cavecreekbeerborough.com or call 602-505-8559. You'll be glad you did. Well, I'm ahead now.